One, aren't we having a great day? I just want to do a couple of housekeeping tips. Number one, please go to the Maimah booth. You're going to be able to receive information on fibroids. Also, be sure to check out the Retrophin booth, the uh, um, ASI booth. We have Kazar as well as Vertex. So we have a lot of folks that are industry experts waiting to talk with you about questions you may have about certain therapeutic areas. So now we're going to bring you this amazing dynamic discussion on breast cancer, which is intergenerational. This session is brought to you by Janssen and ASI. So just in terms of some quick facts, according to the Centers for Disease Control, again, we know that African American women do tend to have breast cancer at the same rates as white women, but we do tend to die more from it. And we want to talk about this journey. The objective of today is to be able to link you who have, those of you who may have breast cancer, who have family members that have breast cancer, to support services that are real, that are in the community, and we bring you these ladies who are really trailblazers. First, I'd like to introduce Karen Jackson, who you've met at some of our summits before. Karen Eubanks Jackson, based in Houston, Texas, founded Sisters Network in 1994. So that is revolutionary because I'm sure in 1994, Black women didn't even want to share with each other that they had breast cancer. And she started it to connect with other African-American breast cancer survivors. In founding Sisters Network, she endeavored to make a difference on a national level. That's why Sisters Network has chapters in major cities across the nation. She wanted to break through the silence and shame of breast cancer that immobilized many African-American women and ultimately impeded their early detection and would affect survival rates. Next, I want to introduce you to Maimah Karmo. Did I get it right, Maimah?
You did.
Great. Maimah founded the Tiger Lily Foundation, which provides breast health education, empowerment, wellness, and transformational programs to young women. Maimah was appointed to the Federal Advisory Committee on Breast Cancer in Young Women, a committee established by the Affordable Care Act, on which she works to develop initiatives to increase knowledge of breast health and breast cancer for women under the age of 45 and those at heightened risk for developing the disease. And I welcome our presenters today.
Thanks for having me.
Good morning.
Good. So I want to just start with you, Karen. Tell me about your experience, how you first learned that you had breast cancer. Was it in 1994 or was it before 1994?
Yes, I was diagnosed in 1993. I started Sisters in 1994, and we talk about that a lot. And in 1993, we all know African-American women, the industry of breast cancer put a lot of shame and didn't respect Black women at all in the industry. When I started, I was diagnosed with stage 2 breast cancer, which is not a bad stage, but you still have to have your chemo 6 months and your radiation. So I fared pretty well with that. But during my time of my journey of having the treatment, I was able to meet women in different circumstances who were breast cancer survivors. And I noticed that there was no unity and no sisterhood pulling us together. So there were groups like the American Cancer Society and other, organized breast cancer groups, but the women weren't staying. And I wanted to have a national organization where women would come together, have the sisterhood, and have a network across the country. So starting with no money, no funding, I was able to pull together women from across the country, and today we're still here 27 years later. So
that is fantastic. That's a great story. It's interesting how certain situations just make you stronger. And,
absolutely.
And it pulled the resources and the strength for you to launch this national initiative that's touching thousands of lives. So thank you. Maimah, tell us your story because you were young, I believe, right? When you were
Yeah,
diagnosed?
31 years old.
Mm.
I will say my
You look
mother is a nurse.
31 years old, Maimah.
I know I stopped aging after getting diagnosed. I'm reverse aging, but I'll talk about that and the importance of lifestyle. So my mother's a nurse, which was a blessing for me, and she taught me the importance of breast self-exams at 13 years old. And I remember her telling me, do your breast exams every month. It's important to know your body. And if there's a problem, let me know to your OBGYN. And she said, no matter what kind of doctor you have, you are your best advocate. You know your body better than anybody else. And so I did my breast exams every month religiously and never imagined I'd be getting breast cancer. 18 years later, taking a shower, there's a lump in my breast. And my mother's words came back to me. She said, you'll know. And I stress this because young women often aren't told to do breast exams early. And some organizations feel like it's not, you shouldn't tell a young woman to do breast exams because, it's not, they can't detect breast cancer that way. However, for a long time, the average age for screening was 45 years old or 50. Mm-hmm. And so my mom, thank God, got me doing my exams. When I found the lump, saw my doctor, and then she got me to do a mammogram and to go see a breast surgeon who then told me that I was too young to have breast cancer to come back in 6 months to a year or when I was 40. And I say that because if I waited till I was 40 years old, I would be dead today, most likely, or metastatic. And so it really became important to me to ensure that women who are younger and women of color had access to education, to powerful self-advocacy tools, knew our rights as human beings, and we would advocate for those for change. Black women, have more aggressive breast cancers, are diagnosed at earlier stages, have higher recurrence rates, and 40% higher mortality rates, and that's unacceptable. So that's kind of how I started. I had triple negative breast cancer, which, as you know, is the most aggressive kind of breast cancer and found often in Black women. And like Karen, I just wanted to make a change. I believe that service is the rent we pay for a living. If you're alive, you have to serve. And that grew from one story to a national organization and now globally supporting young women facing stage 4 breast cancer, and women of color.
Excellent, excellent. So now, Karen, when you were diagnosed?
I was 50 at the time.
50,
and,
okay.
And I too was looking and taking care of myself, getting my mammograms early because I did know I had a family history. So that gave me some confidence to know that I should be more, be an advocate for myself. But at the same time, I was faced with the fact that I was getting my mammogram each and every year, and the doctor would say, good luck, that was fine. But they never told me to look for anything else because I thought I was doing all that I could do. And I knew that there was something wrong with my breast, but the doctor, after the doing the exam and doing the mammogram, he said, there's nothing, you're paranoid, don't worry. So I insisted, what else is there that he could do? Because I knew that there was something wrong. I could feel it, not with my hand, but I felt the sensation in my breast. Fortunately, I was with this doctor long enough that he took pity on me because they didn't want to do this. They gave me an ultrasound, and that's how I found my first cancer, because of the ultrasound. So as an organization, we immediately incorporated within our information, because this was not shared in other information, that your baseline mammogram and a baseline ultrasound is very important to make sure that when you start out, that there's nothing wrong. So I never had a baseline ultrasound. So it took me, he said it had been there 6 years. Fortunately, it was a slow growing cancer, even though it reached 3.5 centimeters, which is large, but slow growing. So information and being an advocate for yourself can save your life.
Excellent, I understand that. So Maimah, tell me, you've done some amazing programs. You're disrupting the space. What are you doing in advocacy that's really connecting with all of these young women?
Well, I think it's time we flip the table. I think for a long time it was kind of like, here's a patient, here's a nurse, here's a doctor, and here's a scientist, and you're just you're here. And we got to flip that table real fast. So we're flipping it everywhere. I would go to San Antonio Breast, go to ASCO, go to many conferences to hear people talking about health disparities. Black women are in clinical trials. We're not self-advocating, but the system that sets this up is set up for us to not be successful in many ways.
Absolutely.
So it's set up where somebody has a thought that, you know, we're at this level of power. They built these systems that keep people of color out of many fields, whether it's science and technology, healthcare, and in breast cancer, we're dying the fastest. And so I kept watching these conferences, sitting in these rooms where I wasn't at the table, and they were talking about Black women, and that's unacceptable. And so I said, why are you discussing a Black woman's lifestyle and lifespan and things that pertain to her healthcare when she's not at the table? And I was at San Antonio Breast in 2018, and I just got really upset. And I said, someone said we can't find Black women to enroll in clinical trials. And I said, I don't understand. I mean, I am a Black woman, been doing this for 14 years, not as long as Karen, but I have a lot of Black women who really would like to know about clinical trials and be at San Antonio Breast, collaborating with scientists. So I went and brought women of color to San Antonio Breast. It happened really fast. People said it wasn't possible. We didn't have money, to Karen's point. People weren't really funding Black-led organizations.
It wasn't possible. They said it wasn't possible to get women into
because they said that, they said, what, you know,
We
you don't
didn't
have enough
care.
money.
We don't care.
They say it's not possible. We don't really engage. We don't really have advocates involved in the scientific sessions. That's for doctors and scientists and researchers. But also we plan the event, I think 4 months out. And when you have events at these big conferences, you plan them for, you know, up to a year before they happened. And to Karen's point earlier, for a long time, they weren't funding Black-led organizations as they were funding other white organizations. So talk about disparities and even advocacy. How can you do the work to help your community when you're getting 1/10 of what they're giving, or 1% of what's going to a white organization? So I began talking about these things, and we brought women of color, Black women, to San Antonio Breast last year. For the first time in the history of this 40-something-year-old conference, they had the biggest number of Black breast cancer advocates at the conference, and people were stunned. We walked in there singing, "We are family," we're holding hands, we sang our anthem, and we had Black women advocates who were patients on the stage talking about disparities, talking about barriers, and talking about why our voice matters. And what we did was we really just upended the system. People saw the disparities in a deeper way. We began to train Black advocates. I love partnerships, so we began to reach out and ask, who can we partner with to help you understand our problem? Because what I saw as the other problem is that people are creating solutions for us, but not with us. You can't do that. Mm-hmm. And so, you know, so we began doing that training. We put together an alliance. We've been having just conversations, and we launched our inclusion pledge, through which we want to have every system that affects a Black woman's lifestyle or lifespan look within and be accountable for how they're either persisting in creating barriers or eradicating them. And so we're just disrupting all over the place.
No, that's...
I'd like to add to what Mama is saying, and I can start with saying that it's a great time to be Black in America, and especially in Black health, because I've spent a quarter of my life in breast cancer when they weren't listening, they weren't helping, they were dismissing you, but they never thought that Sisters Network would last. So we've been in existence 26 years now. We've impacted lives.
Congratulations.
We set the foundation that yes, Black women do care, but most importantly, like you, Rosalind, excuse me, Black lives matter. And the COVID-19 and the economy, all of these things have enhanced the problem of health for Black people. So the time is now, not because we weren't doing the work, it's because the spotlight is now on the disparities that have always been there, the injustices, the inequality. We were rallying against it, but without the community coming together and showing that this is necessary, we were ready to step in and say, this is what we do, this is why we do it, because white organizations aren't being able to attract or keep Black women within their organization. We join, we leave. I have women in our organization who have been with me for 26 years. Those are long life, living people like myself. And one president's been a president for 18 years, and she's still at it. The passion and the determination, we can do anything, but the doors have to be at least cracked in order for you to go in. So like Mama says, this is the time and this is the place, and we all need to get in the door, have a seat at the table, and make the change because we're capable. And I've heard for 20 some years that we don't care, we're not capable, and women they won't show up. So we've proven that wrong with our programs. Our national walk, we attract some 8,000 women from across the country. They've never seen that before. They've seen it for other reasons, but not for breast cancer. Mm-hmm. So they don't think, they think differently now. We were able to start the first national breast cancer conference. They didn't believe in conferences. They wanted us to come to their conferences. So as you were explaining, you do it the way that we know our families, our community want to show up for us. And that's the difference. Women are showing up and showing out.
That's right.
Yes.
Our time is now. Go ahead, Maimah.
Well, when I had my San Antonio breast event and listening summits, Black women came to the events, and some said they never met a Black breast cancer survivor who was a CEO of a nonprofit nationally. They never met a woman who had breast cancer who was Black or metastatic. And that brought tears to my eyes because Black women want to be heard. We want to be understood. And also people avoid the word, our trauma is hard to look at. There's historical trauma that's happened over the hundreds of years that's again systemic. And so we have to have places like what Karen's organization does and mine does to bring women together to not just to be heard, to be amplified, and to be really empowered advocates. And so, our work builds community, it builds women's strength. Through our cohorts, we've trained women who came into the door first, shy, unsure of themselves, and now they're working with scientists across the world to co-create the next generation of cures for Black women. We have to invest more in Black PIs, private, investigators for trials. I want to see more Black doctors and Black nurses. And I always say to people, if I am possible, so are you. There are more Karens out there. There are more Maimahs out there. They need a platform to be lifted up on. That's what we're doing every day.
Absolutely.
Every day.
And this is such a wonderful show of solidarity that we all come together. We all have our different paths, but we come together because we love our people and we know that they can thrive given the benefits and the resources. Karen, one of the things you shared with me, and it just touched me so emotionally, when you have breast cancer and you're going through chemo, it's hard to work. What kinds of support systems do you help and make available to women who have these problems?
Yes, what we try to do is make sure that any woman that calls and joins with Sisters Network, whether they join or not, if they need the services that we have, we do provide it. First and foremost, we have a breast cancer assistance financial program that we help women with their rent or mortgage, or we added food this year. It was the first time we added groceries because the need has gotten to that point. But it covers some other items that, that affect us financially. But most importantly, we provide the sisterhood. We pair you up with someone who's been through the breast cancer journey that you're getting ready to go through. We make sure that that person who's talking to you has the resources in their community, or if it's on a national level, they contact national to show you where the resources are, because they are out there. But if you don't know where to look and you don't have the confidence to advocate for yourself, you need someone to guide you. So that's what Sisters is capable of doing. We have ambassadors too who are located in cities where we don't have affiliate chapters, because we don't have a chapter in every city. So I can call somebody in a state that we're not in and say, what are the resources in this city? They would look it up for us and they would help that person in that city. So it's a network of women who are dedicated and willing to educate themselves to help the community. And it's a beautiful thing. And it's not easy because the information is continuously changing. And there's so much out there, but you have to be knowledgeable enough to help that person gain the knowledge that they need in order to do well. And I want to point out, sometimes the industry itself in our community, we think only of women who have no insurance and who have low income. Unfortunately, the women too that have insurance and have income are not getting the basic thing of a mammogram or an ultrasound. The action is what we need from women in our community. And I think the epidemic of what's going on in all the different areas of our life are making women now rethink. We're getting more calls from people who want to know, where can we get the mammogram? Before, we had to go out to the community to find the women to take them for their mammogram. Now people are calling. So the situation has changed. It's better, but it's not perfect.
No, I agree. And now what are you seeing, Maimah, in terms of, the social determinants of health and, again, the impact of COVID? Are you seeing more women starting to raise their hands, more people being woke? What are we seeing?
Yes. Well, there's a quote that I read. It says, when you squeeze an orange, what comes out is what's inside. And the world's being squeezed right now in terms of social justice and with COVID. And the thing is that Black people are facing the worst disparities they were before, and we are now more than ever. And so, but I think coming with that this year of 2020, it's about clarity of vision. The world's seeing what we've been saying for years in a way that's more powerful and stark. And Black women are getting more uplifted and their voices are getting stronger. And so my goal is I want to have 1 million of myself. I want that all over the world. So we're building an army of angels that we're training on how to be self-advocates, what to ask for, how to teach their doctors what they should be asking them about treatments and screenings and so forth. We're offering people COVID support services where they get pay bills and provides other needs. People don't have masks and gloves and things we take for granted. We think that I can order gloves every other week for my house or mask, but if you're living in an underserved community, getting an hourly wage, you can't afford to buy a $20 box of masks or gloves. So we're giving people tools they need to just stay healthy. We are having an event called Pull Up and Park. It's a movie screening about Black breast cancer next week, Wednesday. So we'll be having a screening of the movie. People will be in their cars. They can order food to come to the cars.
Who's in the movie? Tell me about that. Are you producing movies?
I will be soon. But it's a long, I don't know all the names yet, but I haven't watched all of them, but I hope to advise on them. But it's called Pull Up and Park by Mega Mind Media, and it's going to be offering people screening. We'll be handing out bags of gloves and masks. We create literature for Black patients to ask their doctors what to ask their doctors about when they're in the appointments. We do summits. We have advocate toolkits, and so our whole goal is to figure out what are the barriers to care, and how do we train advocates to work towards ending those barriers by creating content, tools, technology, partnerships to make those things happen.
The toolkits for asking what to ask your doctor is so important. You can put it in your purse because when you get to your doctor, you forget.
That's the truth.
And we also tell women to either take a member of sisters with you or a family member who can listen on your behalf. Because trust me, when the doctor's talking to you about your body, I don't care how intelligent and educated you are, you don't hear everything. You really do not.
And women don't know what to ask for sometimes either. We don't know what to ask. When you're that scared, you forget what to ask.
Yeah, that's
you don't know about clinical trials.
Yes, ask your doctor. Pamphlets are available. Now I'm gonna give you an example. Now I'm a long-term survivor, and I've been at the same medical center for 27 years. And I had to advocate for myself even the 4th time around with breast cancer. And if I didn't have the education and the desire to live and the desire to fight for myself, I still wouldn't be here after the 4th time. I was getting the mammogram, I was getting the ultrasound, which is supposed to be the protocol for everyone. And the doctor says, 1 more year, you're fine. And I told the doctor, that sensation is there in my left breast. I am not fine. I need something else. So we decided to get a MRI, which is very expensive. And it found 2 new cancers, Fortunately, it was at DCIS. But if I had not requested an MRI,
Okay,
I
what's
would be
CIS,
getting
Karen? I'm sorry.
ductal carcinoma in situ. It is the beginning of cancer. So I felt it, not with my hands. I have learned my body well enough, and we try to tell women, you know your body, you just have to sit down and listen. My body told me there was something going on in my left breast. I didn't know it was two cancers, but I felt something. The MRI showed two. And then after the MRI, they wanted me to do the ultrasound and the mammogram again because they just couldn't believe that it missed it. So there again, Maimah, we have to now start talking to women to say, have you ever had an MRI? Because some of us are walking around thinking we're okay, and we're not.
We're not.
But
Right.
I wouldn't have not included this because I've never heard of anybody or experienced it myself. But if I had not talked and spoke up, they wouldn't have found it this year.
No, thank goodness that you did.
That's across health systems or health issues. Last year I was coughing for a long time. I couldn't breathe. I had fevers, and I went to the doctor and they told me I was fine. I went back 2 more times. They said I was fine. I had to push for a screening and a chest scan, and I had pneumonia. I was dismissed 2 or 3 times. And so it's not just with breast cancer, it's across disease states.
That's why,
Black people, to your point, Rosalind, Black health matters.
Yes, it
We have to be our
does.
best advocates 24/7.
Yes.
Right. Because science isn't perfect. And sometimes that practitioner isn't perfect. So do you want to just, rely on a system, or do you just want to go for it and advocate for yourself? Because your life is important. There are people that love you. You have a lot to contribute. So you have to stay vigilant.
We have a new hashtag that speaks volumes to about your health. We say, make health your top priority. Even though we're breast cancer, we know it's your total health that you have to be aware of in order to stay here.
Excellent. And we're wrapping up. Maimah, what is the hashtag that your organization has?
Listen Up MBC is one. Listen Up MBC. And no, KNOW, more disparities.
Okay.
No more disparities.
And
so no more, and no more.
Rosalind, I have a book coming out this month. It's called In the Company of My Sisters. Excellent. And I'm finally getting it out because I had a lot to say, and I made sure that I took the time. This is the year because there's so much going on. So it covers the 27 years of sisters and my journey.
That's wonderful. And I'm sure it will inspire so many.
Thank you.
I'm so glad that you did that.
Thanks for having us.
All right. Well, thank you all for a wonderful discussion. These ladies are active and vigilant, are in the community, so you will still be able to see them, talk to them. They're always doing programs. So I do hope that we support the great work that they're doing. God bless you both. And thank you for joining us at the Black
God bless you. Have a blessed day.
Thank you.
Thanks for having us.
Okay. Bye-bye.
Bye-bye.